Just check your audio video in your YouTube. So next 1 hour we are going to discuss important microbiology questions, most expected important topics. Same question may come, may not come. Okay, but these type of questions, these areas are very important. 20 hand-picked selected areas. Window is not opened. Now the time is 6:59. Waiting for 30 seconds to start. Meantime, you can type the quality of audio, video, everything is okay. Then directly we can start. I started 1 minute earlier. Okay, right. Yeah. Good. Great. I'm seeing your feedbacks. Thank you. Good evening. Everything is fine. Most punctual teacher. Thank you. I'm maintaining. Good. We start the session. First question. A 5-year-old child presents with fever, sore throat. Fever, sore throat, there are 100 differential diagnoses you can give. But one and only you can diagnose grayish white membrane on the tonsils. Pseudomembranous tonsillitis. Many people already typed, sir, it is diphtheria. Good. Pseudomembranous tonsillitis, only diphtheria. That means you already studied. That show your what already feed is here. Culture grows gram-positive rod. Another point favoring your diagnosis. Metachromatic granules. Game over. It is 100% case of diphtheria. Now you pray the God. The question should be known question to me because I diagnosed it as not only you. 90% of the kids will diagnose it as Corynebacterium diphtheriae. The exotoxin produced by this organism inhibits which of the following cellular process? Direct question. What is the mechanism of action of diphtheria toxin? Make it easy. So the take home message, you may get a question on mechanism of action of toxin because culture medium, mechanism of action of toxin, vector or hepatitis panel, microfilariae tail identification, these are all must to know areas in microbiology. So what is the mechanism of action? It acts on ADP ribosylation of elongation factor 2 and finally inhibits protein synthesis. Got it? ADP ribosylation of elongation factor 2 inhibits protein synthesis. Not only this toxin, one more toxin also. What is the toxin? Pseudomonas toxin. Learn few points. Another toxin, Pseudomonas toxin. Another toxin is Pseudomonas toxin. Okay, any toxin inhibit protein synthesis? Another mechanism acting on 60S or 28S ribosome. Because what is the function of ribosome? Protein synthesis. They inhibit protein synthesis is Shiga toxin or virocytotoxic E. coli, virotoxigenic E. coli. One is Shiga toxin. Another one is virotoxigenic E. coli. What is the new word? Nothing. It's nothing but enterohemorrhagic E. coli O157H7. Enterohemorrhagic E. coli O157H7. These people inhibit protein synthesis. And you can remember what are the toxins acting on cyclic AMP. You know the mnemonic. What is it? PACE, pertussis, anthrax, cholera, E. coli, labile toxin. E. coli, labile toxin. Very good, very good. I got very good feedback. Sir, bigger fan, Dr. Deepik K. Okay, good. Thank you very much, my dear kids. Very good. So, the take home message, one question you can get it from toxins. You must know about all the toxin. For example, tetanus toxin. What is the mechanism of action? Don't read. It inhibit the release of GABA glycine. You read, it cleave the snare protein. Number one. Number two, inhibit the release of GABA glycine. Where? Presynaptic area. So read fully. That is important. Read 3 points. For example, botulinum toxin. What is the action? Cleave snare protein. Inhibit the release of acetylcholine in neuromuscular junction or presynaptic area. These 3 points important. You read fully. Don't read inhibit release of acetylcholine, inhibit release of GABA glycine. Sufficient. And I will not say it is insufficient, but read fully. 360 degree. Got it? Next is, which of the following emerging viruses, that means it should be a new virus. It was decline, suddenly increases. That is called emerging virus. Has segmented negative sense RNA associated with hemorrhagic fever in Indian subcontinent. Wow. Core microbiology mixed with update, latest everything. So first thing, negative sense. So what are all the negative sense viruses? You should know that. Nipah virus belongs to Paramyxoviridae. KFD, flavivirus. CCHF, Crimean Congo hemorrhagic virus, Bunya. SARS-CoV-2 comes under Coronaviridae. First, you know the family. You should know either positive sense or negative sense, which both I have mnemonic to you. I gave the mnemonic to my kids. What are the both mnemonic? Positive senses, patient with congestive cardiac failure. Negative senses, Bopra. Which one you want? Bopra, name is good? Right. Bopra is negative sense. Paramyxovirus is negative sense. And Bunya, negative sense. So I will remove these two. Flavivirus positive sense, coronavirus positive sense. I'll remove this. So negative sense, these two. Hemorrhagic fever, name itself, Crimean Congo hemorrhagic fever. So some people may use the clue, hemorrhagic fever, name itself. Hey, don't worry. Nipah virus also causes pneumonia and hemorrhagic fever. Majority of the emerging viral infections causing hemorrhagic fever, and both present in Indian subcontinent. Both present in Indian subcontinent. Got it? So now I got a thing, Dr. Manifest sir. Good evening, sir. Kindly advise about crash course. Yes. Listen to me. So these two have tough fight. But who will the savior? Every question have beautiful clue in the answer, in the question itself. Segmented. So what are the segmented RNA viruses? Is name, the mnemonic is Arbo, Arena, Rio, Bunya, Arthomixo. All these people are segmented. That's all. Now you can answer Arbo. So among the thing which is causing hemorrhagic fever and segmented RNA is Bunyaviridae. So Crimean Congo hemorrhagic fever. Crimean Congo hemorrhagic fever. CCHF. Got it? You need to approach like this. So you need to correlate many things. First, you should know what is negative sense virus. Second, you should know what is segmented RNA. Third, hemorrhagic fever. Fourth, present in Indian subcontinent. But all four are present in Indian subcontinent. Don't worry. Next is, suppose if yellow fever like that, it may not present in Indian subcontinent. like that. So that also some clue. Be careful. Sir, what is Bopra? Bunya, Orthomixo, Paramixo, Rhabdo and Arena. Veterinarian develops high-grade fever, conjunctival suffusion. The word conjunctival suffusion, wherever it comes, next minute your mind first think leptospira. Past 4-5 times the word came conjunctival suffusion. Okay, myalgia. After working with livestock in flood affected region, that's another clue. Monsoon, flood affected region, or taking bath in the contaminated pond. Microscopy of the organism shown in the image. So the causative spirochete most likely transmitted. So they themselves mentioned it's a spirochete. Spirochete, flood affected region, conjunctival suffusion. What is the spirochete? Without seeing the picture you can answer. It is leptospira. But see the picture. A beautiful picture. What is the staining? It is not what is called a dark field microscope. This normal microscope. This staining is called Fontana stain. Fontana stain. This is Leptospira interrogans. This is Leptospira interrogans. I can call it as interrogans. How, sir? What is meant by interrogation? Questioning. Asking question, interrogating. So see the organism. It is hook-like structure, question mark. See? Question mark. Like this. It is having typical question mark. Interrogation. Sewage water contamination. Fontana stain. Very good. So, usually I want to make a question. Original question what I want to make. What is the selective medium? Another thing already the question asked previously. Second came to my mind. What is the gold standard test? MAT test. I am giving lot of clues to you. MAT test. So this also we asked previously. So I want to ask simple question. NEET questions are look simple but difficult to answer. Questions are little easy. What is the mode of transmission? Everybody immediately thinks, sir, rodent excreta. Some people see the second off on rodent, they go for the answer. Is it right? Many people answer dinger ring. Okay, yes, it is through animal excreta. So the mode of transmission, entry via abraded skin, skin exposure to contaminated water. It is not by infected tick, saliva or rodent feces. Inhalation of rodent feces, hantavirus. Hantavirus disease, rodent feces. Bite of an infected tick, many things are there. Just now, KFD, Caissenus forest disease virus, Lyme disease, etc., etc., babesiosis, etc. Contact with dog saliva. Which one? Rabies. Got it? So mode of transmission of leptospira is entry through abraded skin. Entry through abraded skin. Got it? Hope people understand this. Right. Next is a stool sample from an orphan child shown in the image. What is the most likely diagnosis? So here nothing, only orphan child. That means malnourished, poor hygiene possibilities, and only clue the egg. See the egg? How to describe? Beautiful clear shell. Clear shell, 48 blastomeres, filled with both 48 blastomeres. What is it? Egg morphology itself you can answer. This is clear shell with 48 blastomeres. So you are lucky, directly they ask what is the diagnosis. Otherwise they will ask the question. One question, what is the mode of transmission? Number two, what is the infective form? What is the skin manifestation? Many things they'll ask. It is a case of hookworm, Ancylostoma duodenale or Necator americanus. Ancylostoma duodenale. The common name is hookworm. Infective stage, falciform larva. What is the mode of transmission? It penetrates the skin. It causes the itch called ground itch. Cutaneous larva migrant other than Ancylostoma duodenale. Other people causes cutaneous larva migrants. Iron deficiency anemia. Treatment albendazole. Learn many points. Barefoot penetration. Right, my dears. I'm seeing this called. Okay. I'm seeing the chat box. I'm so happy with the chat box. These are the questions they ask in the exam. This is the level of NEET exam. Okay. But because of your panicity, you are digging your own grave. I always used to tell my kids, don't be panic, easy to tell but difficult to follow. You practice it. Who practice that, they will get 4 or 5 questions extra than normal person. That makes the difference. Got it? Right. How the ascaris look like? If the egg is having serrated margins, full of larva unfertilized, the serrated edges, shrunken larva, fertilized egg of ascaris. Treacherous, you are aware of that. Barrel shaped egg, 2 mucus plugs. Entrobius, kidney shape. Planoconvex. Planoconvex, kidney shape. So by telling the name itself, you should tell how the egg is look like. You practice it. Dr. Rebecca, sir, I joined your all sessions since 2024 January. Thank you, dear. So, difference between cutaneous larva migrants and larva currents. Dr. Hina. 3 difference. Number 1, basic. It is caused by cutaneous larva migrants caused by hookworm and larva currents caused by strongyloides. Number 2, urticaria present in larva currents. It is usually less or absent in cutaneous larva migrants. Number 3, perianal involvement present in strongyloides. It is absent in cutaneous larva migrants. That's all. Learn these 3 important differences. Okay? This is for Dr. Hina. Next is a 50-year-old alcoholic male presents with fever, cough and current jelly sputum over. So 50-year-old fever, cough means my mind always goes to Legionella, especially smokers or any mycoplasma or streptococcus pneumoniae, old age. But only one clue, current jelly sputum, mucoid sputum, Klebsiella. In case of rusty sputum, streptococcus pneumoniae. In case of frothy sputum, interstitial pneumonia. Green color sputum, pseudomonas. So every word is a clue. Every word gives a clue. Current jelly sputum, my mind fixed with Klebsiella pneumoniae. Sputum smear shows encapsulated gram-negative rod. Game over. Suppose if the close tough fight is, maybe if the red current jelly is not there, they put some mucoid colonies, streptococcus pneumoniae. But gram-negative rod, you confirm, encapsulated, it is almost confirming. They themselves confirming it is Klebsiella pneumoniae. And which strain best demonstrate the capsule? What is the capsular strain here? Our mind set up India Inc., nigrosin strain, capsule, cryptococcus. We are not thinking more than cryptococcus. Yes or no? Honestly tell. India Inc. strain means which come to your mind immediately? Cryptococcus. No, don't go with this view. You have a broad view. Okay, don't go with only focus. So any capsule you can demonstrate by negative strain with nigrosin. Ziehl-Neelsen is acid fast stain. It stained the cell wall of the acid fast bacteria. Methylene blue is a simple stain. Just you want to know the size, shape, arrangement of the cell. Albert stain is a special stain for metachromatic granules. Metachromatic granules. I got some questions. Klebsiella, no? Yes, it is Klebsiella pneumoniae. Organism, first you identify the organism. Klebsiella pneumoniae, which is capsulated pathogen. Which is a capsulated pathogen. Demonstration of capsule by negative staining with nigrosin. Even though you don't know how to come to conclusion, sometimes in the exam tension, you forgot current jelly. You are not able to identify Klebsiella pneumoniae. Don't worry. How to demonstrate capsule? Negative stain. Even though if you are not able to come to conclusion, you think of me, think of my notes. Ziehl-Neelsen stain, acid first. Methylene blue, simple stain. Albert stain, metachromatic granules. So you can rule out. Sometimes you can shoot, sometimes you can eliminate, whatever it may be. Okay. Got it? Ultimately, you should get the correct answer, but the path may be different. One kid go to direct, another kid will eliminate. Okay, another kid 50% probability they can choose some way. Try to get the correct answer. Okay, next is no, not all time capsules are negative stain. Some capsular stain also available. For example, Welch stain. Bacterial capsule, there is a stain called Welch stain. You can directly stain the capsule. Antony stain, you can directly stain the capsule. Some stains, that is called positive stain. Here it is negative stain. Got it? Right. Next is, according to Spalding classification, immediately mind, okay, critical, semi-critical, non-critical, I should choose one. Okay. So, which of the following item requires high-level disinfection, not sterilization? High-level disinfection, usually semi-critical. In Spalding classification, immediately you need to think of Spalding classification. Critical needs sterilization. Semi-critical need high-level disinfection. And non-critical needs low-level or intermediate level disinfection. Here, the scalpel, bone saw, okay, even syringe, these need sterilization. We do either autoclave or gamma rays or ethylene oxide, something. Endoscope, actually they should give specific word, flexible endoscope. Okay, flexible endoscope comes under semi-critical. Among the choices, the semi-critical is flexible endoscope. Even rigid endoscopes comes under critical. So, if any other choice is little tough, sometimes we need to eliminate endoscope also. We consider it is a what is called rigid endoscope. You got my point? Here, no need, because scalpel is critical item, bone saw is a critical item, syringe also. Needle with syringe. These are all contact with blood and sterile tissues. Got it? So these are all usually contact with blood and sterile tissues. So no need. They are all comes under critical item. Endoscope, two endoscopes are there, flexible and rigid. Rigid endoscope critical. Here we consider this as, sometimes we need to consider, okay, we need to assume certain points. Flexible endoscope, semi-critical. We are missing your yes. Where is the microbiology train? Now the train is there. I am the trainer. The engine driver minds the train. The teacher trains the mind. I am doing the both. Because I am trainer. I'm riding the train, okay, driving the train or training the train, okay, right. A woman develops placid paralysis. Wow. Whenever placid paralysis comes, immediately your mind go to microbiology. Placid paralysis means first you should think of botulism. You sit, you are in the exam. In the exam, the same question comes. Placid paralysis. The 1 second, maybe botulism. But don't take the decision. Suspect. After consuming improperly canned food. Good. Canned food. Then 100% I decide it is botulism. Canned food, placid paralysis, ultimate combo. Which bacterial structure is infective for this condition? Very fantastic question. Which is infective stage for this condition? So, Clostridium botulinum, there are two infective stages. One is called spore, another one is called preformed exotoxin. In case of wound botulism, and infant botulism, spore is the infective stage. Wound botulism, spore from environment. Infant botulism, spore from honey. And exotoxin, it causes foodborne botulism. And sources, canned food, improperly canned food, homemade canned food. That's all. This is the magic. So what is the answer now? You can tell what is the answer is exotoxin. Endospores also infective stage, where in wound botulism, in the environment, spore will be there, they'll get attached, they germinate. Honey contains spores. So preformed toxin, you can get it in foodborne botulism. What are the my mnemonic? D. You just recollect, everything should come. What is D? Diplopia, double vision. Dysphagia, difficulty in swallowing. Slurred speech, dysarthria. Decreased deep tendon reflexes, and top to bottom, descending paralysis. Okay, weakness. And you know the mechanism of action. What is the mechanism of action? Botulinum toxin cleave the snare protein, inhibit the release of acetylcholine in neuromuscular junction. Okay. App answer we changed. Yes, my dear. App answer we changed. App answer was C. Typographical error. It made C. Okay. But that's not correct. We already changed it. When I'm checking in the evening only, I checked actually. That time I found it rectified. It's a typographical error. I'll accept. If you're good in subject, if you studied properly, don't worry, you can argue. So I got some questions in the my Telegram group. Sir, you taught like this, the question answer is like this. I'm so happy. Because you are comparing, you are memorizing, you are not believing what is your reading. What you studied, some discrepancies there, whether it's an update, whether it's a wrong, whatever it may be, get clarified. Got it, my dears? Right. Instead of blaming and scolding, whatever it may be, our duty, get the correct answer, get clarification. Many times it may be an update. Few times it may be an error. Okay? Right. Nothing is 100%. Yesterday, one question, SSPE question was there. It was wrongly mentioned because the time duration. When we make the question with one answer, but when typing it go to typographical error, we rectified. Wherever problem is there, we'll do that. Don't worry, my dear. We'll accept. We will not argue. Healthy fights needed. It's not fight, it's clarification, my dear. Why should I fight with my kids? It is not fight. Don't think fight. Nobody is 100% except Almighty. If something is wrong, we will accept, we will rectify it. That's all. A case of, we are doing utmost care to give 100% authenticated data. Even some breach is there, we'll accept and we'll fill the gap, fill the breach. That's all. A case of cutaneous leishmaniasis, parasitology, diagnosed in man from rural Rajasthan, whatever it may be, India. What is the most likely vector? This is a question always we can expect. Vector, vector, vector. Tick is the vector for. Or babesiosis, what is the vector? Like that. They may ask filariasis, what is the vector? Dengue fever, what is the vector? Yellow fever, what is the vector? Plasmodium, what is the vector? So always you read my vector table, 100% you may get a question. Okay, it is what is the vector for leishmaniasis? That's the question. Just one liner. Vector for leishmaniasis is sandfly. It is in India phlebotomus. In India it is phlebotomus. Anopheles mosquito for plasmodium. Aedes mosquito for, who are all the people Aedes mosquito? Dengue, yellow fever, chikungunya, dengue, yellow fever, chikungunya, Zika, all people. Sometimes they may ask Similium fly is vector for Onchocerca valvulus. Triceps fly is vector for Lova. So wherever vector is there, you must know. Louse is vector for epidemic typhus, epidemic type of relapsing fever, trench fever. You should know everything. Vector, vector, vector is sign of victory. Whoever read vector, they are reaching victory. It is not vector, it is victor. Victory. Okay. If you want to succeed, please read all the vectors. Sandfly from Bihar of West Bengal. No, he may be a resident of West Bengal. He went to Rajasthan. It's just a story. Don't go in depth of all those things. Okay, right. But it is common in Bihar and West Bengal. The name of the fever is leishmaniasis called dum-dum fever. Where is dum-dum? Calcutta. Okay, I mean West Bengal. Okay, don't worry. Good. Next is, in a bacterial growth experiment, cells are inoculated into fresh medium. For several hours, there is no change in colony forming units. Which phase does it describe? It is a question of, after seeing the choice, we decide immediately the mind. You can think of this curve. What is the curve called? Growth curve. This is time, this number. So lag phase, log phase, stationary, decline. So don't worry. In case of log phase, it is increasing, decline phase decreasing number. So I will remove log and death phase, decline phase. These two, some changes in numbers are there. Where there is no change, one is lag phase, another one is stationary phase. You got it? Somebody asked the question just 10 minutes before. Just before coming to the studio presentation, I want to see what is in my message, in my group, Micro Magics. I used to see once in 2 hours like that. One kid asked the question, which I want to discuss. But before that, they also think like me. I'm so happy. Okay. The question is, stationary phase also, there is no change in colony forming units. Lag phase also, there is no change in colony forming units. How to choose, sir? Purposefully I gave this to confuse you. And you need to get clarified from the question. There is a clue in the question. What is the clue? This is the hidden clue. Several hours, initial few minutes, or initial few, maximum 1 hour like that, 2 hours like that, it may be in lag period. Initial. But when come to several hours, it comes in the stationary phase. Several hours, it cannot be lag. Okay. After some period of time, okay, it start multiplying. After multiplying, it becomes stationary, then it going to die. Okay, meaning lag is not possible. Yes, yes, Anshita Jain. Anshita Jain, you got it? So now I can say the answer is stationary phase. Suppose if I don't want to confuse my kid like this, the word several hours is a clue. Okay, I can give another clue also. If I give the bacteria increased in size, then you can go to which phase? Lag phase. Or we can see gram variability in gram stain. I add only one word. Gram variability seen. Same history, no change in colony forming units, but gram variability seen. Then stationary. Or I can give one more word. Sporulation seen. Stationary phase. These are all 200% we can go to stationary phase. But you people concentrate on sporulation, storage granules, those things. Nobody think of several hours. Because of that, I gave this question. You got my point, my dear? Right. Great, great, great. Bacterial susceptibility, log phase. Bacterial susceptibility, log phase. Good. Next is a 12-year-old boy presents with new onset of seizures. MRI shows multiple calcified cysts in the brain. Multiple calcified cysts in the brain, you can think of first neurocystic That's the first differential diagnosis. Apart from that, you can think of brain cyst, toxoplasmosis, even tuberculosis, anything you can think. Okay, stool exam is normal. Which of the following likely source of infection? Stool exam normal. Okay, that is confusing. Stool exam, sometimes it may be normal. It's not 100% sensitive, foolproof exam. If something is, if we find, well and good. So it is a case of neurocysticercosis. Number one. And what is the infective stage? That's all. It's a direct question. How he got the infection? It is caused by Tinea solium. There are two infective stages are there. One is called Cysticercus cellulose. Another one is Hexacanth. There are two things are there. Cysticercus cellulose and this thing. Cysticercus cellulose leads to diarrhea. Eating egg, neurocysticercosis. So it is mainly due to fecal oral ingestion of human tapeworm egg. Which tapeworm egg? Tinea solium. Ingestion of contaminated pork leads to Cysticercus cellulose diarrhea. Snail containing water, no use, because snail is intermediate host in trematodes, but directly it may not affect. Larval penetration of barefoot hookworm or Strongyloides stercoralis. You got my points, my dear? Hexacanth. 10 more questions, don't worry. 8 o'clock class will be over. A diabetic patient with ketoacidosis, black necrotic lesion on the hot palate, over nasal crust, black discoloration, and diabetic ketoacidosis, aseptate or non-septate hyphae with right angle branching. What else you want? Instead of giving one word, mucormycosis, they are saying like this. Instead of telling jalebi, they're saying a sweet, thread-like material, sweet with mixed different sizes, round, sticky nature. That is called jalebi. Like that. Instead of telling mucormycosis, they give all the thing. Okay. The question is, which is not useful diagnosis? That is important. Negative. Which is not useful. GMS staining, fluorescent staining, culture, everything is useful. 1,3-beta-D glucanase not useful. Okay. Many people misinterpret question which is useful in diagnosis. No, which is not useful. Be careful. This test is not for MBC, mucormycosis, blastomyces, and Cryptococcus. These three people, it is not useful. Where it is useful? Cap Candida, Aspergillus, Pneumocystis. You got my point? It is not useful, MBC, Mucor, Blastomyces and Cryptococcus. It's very useful, diagnosis of Candida, Aspergillus and Pneumocystis. You got it, my dears? Fluorescent stain very much useful for diagnosis of this one, mucormycosis, fluorescent stain. Culture, they'll call lid lifters. GMS stain, that's a universal fungal stain for many fungus. Next is, a patient receives penicillin injection and develops widespread urticaria. So after penicillin drug, urticaria, hypotension, bronchospasm. So this is called type 1 hypersensitivity, anaphylaxis. Anaphylaxis, type 1 hypersensitivity. Anaphylaxis, type 1 hypersensitivity. That's all. First you consider it is type 1 hypersensitivity. Next, what is the question they asked? Specifically mediated by which immune mechanism? Type 1 hypersensitivity immune mechanism, IgE, activated IgE, break the mast cell, degranulation of mast cell, release of mediators. Those mediators cause allergy or anaphylaxis. Make it very simple. So, immune complex deposition type 3, T cell mediated type 4, okay, and IgE mediated mast cell degranulation. What is the mnemonic? You remember the mnemonic? Acid. One is anaphylaxis, 2 cytolytic, 3 immune complex mediated, 4 delayed. 4 delayed. Anaphylaxis, cytolytic, immune complex mediated and delayed. Got it? Next is, which of the following antigen would be presented by MHC class 1 molecule? Very basic question. Always know rule of 8. 1 interacts with CD8, 2 interacts with CD4. 1 interacts with 8, 2 interacts with CD4, that you are aware of that. And usually MHC class 1 interacts with intracellular pathogens. Mainly it acts on intracellular pathogen, viral antigens mainly. Intracellular means mainly virus. Okay. So here virus is there, it will confuse you, but it is not extracellular environment. If it is extracellular, humoral mediated. Bacterial exotoxin, humoral mediated. Bacterial polysaccharide, humoral mediated. It acts as T independent antigen. So cytosolic viral protein synthesized within the infected cell. Infected cell, if it is having MHC1, it presents to CD8, leads to cell mediated immunity. Leads to cell mediated immunity. Very good, Dr. Anshita Jain, and many people beautifully answered. Okay, and right, they mentioned actually MHC1 endo, MHC2 exo. That's all. Khatam. After seeing the question, what comes to my mind? This is called operculated egg. Commonly seen in 2 people. All trematodes except cystosoma, only one fellow called Diphyllobothrium latum. Diphyllobothrium latum. Got it? So I have the idea of these 2 people. Normal trematodes and Diphyllobothrium latum. See here. Patient who consumed raw water plants presents with biliary colic and eosinophilia. Water plants. Okay, develops biliary colic. So it is fasciole hepatica. Second intermediate host is fasciole hepatica, plant, aquatic plant. Stool microscopy given in the image. What is the first intermediate host? Sometimes my kids, they forgot fasciole hepatica. They may think clonachis sinensis, biliary tract. They forgot about the intermediate hosts. Don't worry. All trematodes, including cystosoma, first intermediate host is snail. Cystosoma only one intermediate host, whatever it may be. Okay, all people snail. And crab is for Paragonimus westermani, second intermediate host. Fish is Clonachis sinensis, second intermediate host. Second intermediate host. Got it, my dears? You can get the answer like this. Toxic shock syndrome results from massive cytokine release. Yes, mainly due to the binding of the bacterial toxin to which of the following? Got it? The toxic shock syndrome toxin act as super antigen. What is super antigen? It bypasses phagocytosis, antigen presentation, antigen processing, everything it bypasses. What it does? It directly go and attach to the CD4 cell, T cell receptor. The MHC2 directly go and attach to the T cell receptor, variable beta side chain of the T cell receptor. That is called super antigen. Direct stimulation of CD4 cell, massive production of cytokines and all other things, but no memory will be there. Okay, there is no memory will be there. Massive stimulation of B cell, polyclonal proliferation of B cell, lot of production of antibodies, cytokines, everything, but no memory. So super antigen attach with T cell receptor of beta side chain. T cell receptor of beta side chain. That is called super antigen. Other example for super antigen: streptococcal pyrogenic exotoxin, malassezia furfur, rabies, HIV, mycoplasma, Yersinia, Clostridium perfringens. Big list is there. Lot of people are there as super antigen. So they attach with T cell receptor, beta side chain and MHC. Got it? Right. Microbes are our grand ancestors and grandfather. Yes. A Superman bypassing antigen processing. I'm seeing all your this thing. Great. TB also super antigen. Many people, big list is there. Not a small list. There is a big list is there. Most RNA viruses replicates in cytoplasm. Which are the following RNA virus? The exception replicating in the nucleus. This is my notes. If you read, when I'm taking the class, I used to tell all the DNA viruses multiplies in nucleus except Pox virus. Vice versa, all the RNA viruses multiply in the cytoplasm except orthomyxovirus, influenza virus in the nucleus. Okay, that is the difference. So all our RNA viruses all multiplies in the cytoplasm except influenza virus. Here there is no logic, only memory. Some questions I made, few questions only from your memory, few questions from logic, few questions elimination, few questions directly shoot. It's a directly shoot question. You cannot elimination everything, you cannot use. If you read, you can answer. Otherwise, go to next question. Like that, this question. Okay, right. I made, even the number of questions are less, 20, but you can get variety. All varieties of questions you got. Influenza, orthomyxovirus. I got confused in polio and influenza. Definitely. In the exam, even you can confuse the rabies also. Okay. Negri bodies, nucleus, lot of things come to your mind. Got it? Right. A slaughterhouse worker, that means zoonotic disease. Presents with fever, hepatosplenomegaly. Fever means I can think of anthrax. And undulating night sweat, maybe TB, night sweat, but undulating fever. So now I'm thinking of brucella. Positive for gram-negative coccobacilli. It is not tuberculosis, it is not anthrax, because anthrax gram-positive and tuberculosis acid first and gram-positive. Choose the correct medium. It is a case of brucellosis. It's a case of brucellosis. So now another, you must know all selective mediums. Castaneda biphasic medium for brucellosis. EMJH for leptospira. Ashdown medium, Burkholderia pseudomallei. Cycloserine cefaxetine fructose agar, Clostridioides difficile. You must know about all selective medium. Either direct question will come like this, or indirectly it gives a clue. Organism grows in Castaneda biphasic medium. Okay, organism grows in biphasic medium. Then it is brucella. Either direct clue or indirect clue. You are having a question without culture. There is no culture of taking question in microbiology. Making question in microbiology, the culture is based on culture. Okay, so follow the culture. This is our culture, to read all culture medium. Follow the culture, my dears. Got it? Right. Next is, now you people believe I will finish on time. Now the time is 7:50. 10 more minutes. I finish always 5 minutes earlier. This is always my, people knows about my teaching. And 5 minutes for discussion. Any questions you can ask, I will give some idea to you. Okay, right. During viral outbreak in central India, several children present with rapid onset of encephalitis and high mortality within 48 hours. The virus isolated from sandfly. So sudden outbreak, rapid encephalitis, high mortality emerging. Okay, what virus it is? This is called Chandipura virus. Name of the virus, Chandipura virus. So Chandipura virus belongs to which family? Pure microbiology question. 90% of the kids will identify it as Chandipura virus. They know because they studied in newspaper. Okay, central part of India, encephalitis, mortality, it is Chandipura virus, no problem. But when microbiology, that is the lacune microbiology, it comes under which family? It comes under Chandipura virus is right. It comes under which family? Rhabdoviridae. You must know virus families. I have posted a lot of flashcards. Each family one flashcard. 8 to 9 important family. Bunniaviridae, hantavirus belongs to Bunniaviridae. Flaviviridae, dengue, yellow fever, Japanese encephalitis, all belongs to Flaviviridae, KFD. Paramyxo, Nipah, metapneumovirus, Enterovirus, mumps, measles, respiratory syncytial, all belongs to Paramyxoviridae. Like that, you must know this. So, Lysaviridae, Rhabdoviridae, rabies virus and sandfly fever. What is called, Chandipura virus. Chandipura virus disease and rabies virus belongs to Rhabdoviridae. Micromagics. My telegram name is Micromagics. Everybody aware of that, my dear? Micromagics, my photo will be there. You can easily identify. Next is a patient in 2025, latest update, presents with flu-like symptom. RT-PCR positive for SARS-CoV-2. Mummy returns, like that. COVID-19 returns. Now, 2 months you have exam. So you may get a question on this. That is my assumption. Because of that, I ask one question on this. But sequencing reveals variant named Nimbus. Who is Nimbus? Okay. Which of the following true regarding this strain? What is Nimbus? What is true regarding this strain? You just see one video I have posted in the group. 20 minutes video about latest updates on COVID-19. Okay. So current RT-PCR test cannot detect the variant. No, it will detect. Because it's a variant of Omicron surface spike protein variant. We are detecting nucleocapsid and envelope, not spike protein. So don't worry. Our PCR kits will detect. variant belongs to Omicron lineage with immune escape features. Yes, immune escapism is there, little high transmissibility is there, but severity not there till now. It shows increased mortality? No. Less mortality, more transmissibility. It has DNA genome, it is RNA genome. Previous also, now also RNA genome. See this picture for you. SARS new variants. One is Delta, one is Omicron. Omicron directly mutates. It becomes NB181, that is Nimbus, LF7, JN1. And these two people, Delta and Omicron, the Delta and Omicron recombines and they give, one is called XFG. So currently in India, XFG reported and Nimbus reported. These two are causing little outbreaks in June month. But we will see what happens next 1 or 2 months. We'll wait and watch. This is the update now. This update now. Okay. Next is, yeah, last question. Go very fast. Memory. Cowdy type A inclusion seen in. Cowdy type A seen in herpes, varicella zoster and yellow fever. Herpes, Lipschultz, yellow fever, Taurus, varicella zoster. Cowdy B, adenopoliocytomegalovirus. Adenopoliocytomegalovirus. So you should aware of all viral inclusion bodies. Okay. Now the time is 7:55. As per my promise, I am closing the show. Don't worry. I'm waiting for some of your questions. How you enjoyed today's session? Will it be useful? Will it useful to you? Okay, number one. Number two, it's a sort of revision. Okay, nothing, I didn't teach anything new. Whatever you studied, we are recollecting in an organized way. The same thing I plan to do in revision series because the exam 2 months postponed. No problem. We start revision soon. Mostly end of this month. Before July 15, we finish our revision. I give 15 days time to you. Daily, just for 5-10 minutes. But at June end to July 15, intensive revision. That means daily spend 20 minutes, not more than that. 20 minutes sufficient for microbiology. You will rock. Even sir, I didn't start microbiology. I forgot everything I started. No problem. You attend the revision series. Definitely you will score, you will rock. At the end of the exam, you tell whether you rocked or not. Okay. This is not a false promise. This is promise from the experience. Got it, my dears? So with this, now the time is 7:58. 1 minute before I'm closing the session. So thank you very much. God bless you. Rock in the exam. We will be always with you. Keep in touch. Thank you. I'm signing off now. Enrichment and enriched medium. Hey, don't worry. Liquid medium allow the growth of one bacteria, inhibit the other bacteria. Enrichment medium, liquid or solid, it allow the growth of all. Enriched with egg, blood, serum. Medium is called enriched medium. Got it? Right. Thank you. Yes, revision in my Telegram group.